Hey everybody, this is Dr. Brandon Blood. Hey, a quick note, well hopefully quick, but a quick note on chronic pain, whether it's chronic like back pain or neck pain, or chronic headaches, or something even a little more advanced is like a fibromyalgia type condition. So a note on that. So when it comes to treating a given condition, when it becomes chronic, it often needs various aspects and kind of an all-encompassing clinical look at it, because when we go from like an acute onset to I've had this now for 3 months or 6 months or a year or even several years, a lot of things tend to change in our systems in terms of how we adapt and how our body adapts to chronic pain. So we usually kind of try to mask it and treat the symptoms with over-the-counter or prescription type medications, which can be helpful to a point. But if that's the only way you're looking at it, the long term often for a lot of people kind of results in ongoing pain or continuous need for medication, which gets very frustrating. So at our clinic, and what we try to teach and educate people on is chronic pain will affect obviously the involved area or areas, as well as neurologically how sensitization occurs in our nervous system into our brain, and then how our brain remaps into our emotional type brain. So we end up with like an anxiety over the issue or depression. There's all these kind of intricate pathways that happen with chronic pain. So having a well-rounded, multimodal kind of approach to treating the condition, again, whether it's chronic like back pain or neck pain or headaches or joint pain or fibromyalgia, which is a little more widespread types symptoms, it needs to be a little bit more well-rounded treatment plan to really tackle it and to give the best chance for recovery. So at our clinic, for instance, we have our kind of, from my perspective, from a chiropractic type standpoint, there's things that can be done. Some things aren't for everybody, some things are, but we pick and choose to figure out what the best thing is for you. As well as the medical side of it, we can do and look at different things medically now to help with that. And then even from a nutritional standpoint. So we look at all these areas that can affect you when you have a chronic pain experience and get it under control, get it more tolerable at the very least. Sometimes people have, say, we always ask, what's your pain on a level of 0 to 10? If your pain's at a 7 and you get it to a 3, that clinically is very successful. Of course, we always want the symptoms to go away, but when we really think about it, if we felt at least 50% improved, then that's a great step in the right direction, and it lays the groundwork for continued type things, whether it's clinically or on your own. So we try to educate and teach on that. But when it comes to chronic pain, it's definitely important to tackle every aspect of it that we can control and we can tackle, versus trying to just treat the symptom of it and leaving everything else as I hope this goes away type of a thing. So you're not alone if you have chronic pain, because many people have it. I have some loved ones that we've been able to help and get. So it's pain isn't pain. Everybody's suspect of pain, myself included. So taking the appropriate steps to ensure getting it under control and looking at all the aspects of it is very important. So if you know someone or you yourself are experiencing chronic pain, take this information into consideration. Consider us in terms of an integrated, comprehensive approach to get the symptoms under control, but most importantly, to regain function and to improve quality of life. So chronic pain can be beat, it can be helped, but there needs to be a strategy behind it more so than just symptom management. So hope you found this information suitable for you or a loved one. Feel free to pass it along. My passion is helping people with chronic pain. And there's a big story behind that. I'm not going to share that right now, but chronic pain can be helped, it can be treated successfully, but oftentimes it takes a comprehensive approach, and that's what we do here. So hope you have a great day. We'll talk soon. If you need help with chronic pain, call our office, comment below, and we'll be happy to reach out to you.